The number of Texans dying from the flu has doubled since 2 weeks ago. We've now had 2,355 flu-related deaths. The hardest hit, elderly Texans. Here in Houston, we've had 7 flu deaths. This is the most active flu season in recent years, and it's not too late to get that flu shot. Even though it's not as effective this year, docs say it's still worth getting. And joining me now to talk about this deadly outbreak, Dr. Danish Ali with UTMB. Now, how do we know for sure? Obviously, a lot of people say, I have the flu.
Right.
And you don't really have the flu unless you are diagnosed with the flu. How do we know that we're hit with the flu?
So it can happen via rapid testing that we can do if the patients come to our clinics. There is a nasal swab that's done. Within minutes, we can tell you. The common symptoms that you're going to experience are fever and chills, night sweats, body aches. You just don't want to get out of bed. You don't want to go to work. You don't want to do anything that involves any sort of activity. You are also having sore throat. You're just fatigued and tired throughout the day. And so those are common symptoms that you're going to experience. But again, in order to diagnose it, you have to see a provider that can do this test and diagnose it as well.
And of course, the flu, when you get it, it's not like the common cold. It really puts you on your ass. And though you're stuck in that bed for quite some time. Why are we seeing an increase in the number of deaths when it comes to flu in Texas this year?
So combination of multiple reasons, one being some folks aren't getting vaccinated. We in the medical community encourage people to get vaccinations. It's also happening in the elderly and in the kids population, people that are immunocompromised as well. And so those are the folks that are commonly getting that, and that's why these people need to get vaccinated. They need to take common precautions, and such as they need to cover their mouth if they're sneezing. It's spread through droplets in any sort of wet mucus, and so if they're sneezing, coughing, those sorts of things need to be covered, and that's how it's spread commonly as well.
Obviously, a lot of our children out there in the community could be susceptible to this. So how can we protect them, being infants, being young kids who are in elementary school?
Yeah. So one of the things that we can do is we can get vaccinated as, ourselves as adults. The second thing is do hand washing. So hand sanitization is very important, so covering your mouth while you cough or sneeze and washing your hands, as I said earlier, and then the vaccination itself being very important.
Obviously, there are a lot of precautions that we have to take when it comes to the flu here in Texas. What other advice do you have for people who are just around a lot of people and they're concerned, like in a workplace where they're coming into constant contact with people, touching, coughing, sneezing? Is there anything besides like those old school SARS masks that you can do besides wearing?
You can definitely do that. Hand washing is the #1 thing that we recommend along with the vaccination, and those are just some of the common things that people should be doing on a normal basis, but especially during the flu season. It's very common to get that vaccine and hopefully decrease the symptoms if you do have the actual flu.
And in the last 10 seconds that we have here, hit it home that people don't realize that the flu still can kill you.
It really can, yeah, especially for folks that, like I said, kids, elderly, pregnant folks, people that are immunocompromised on steroids. Those are all folks that are at high risk to have further complications and serious complications, and so it's very important for those sorts of people to get vaccinated and seek appropriate treatment if they do become having those symptoms, as we discussed earlier. I just want to emphasize it's very important to see a medical professional, get diagnosed. There are treatments out there, antivirals and antipyretics, those sorts of things, and one of the things, again, like I said, is drinking lots of fluid, rest, symptom management, whether it be with the antivirals, like I said, and then also with the Tylenol.
All right, Dr. Danish Ali from UTMB, thank you for joining us here on The Factor Uncensored.